Hi, I'm Michelle Clausen with MIT Medical Education.
And I'm Dr. Tony Philly, and we're here today to talk about the second trimester growth and anatomy scan. So let's get started. The first thing we always do when we are scanning any fetus is to, or any pregnancy I should say, is to do a general overview of the uterus. So I like to just start in the left upper quadrant of the uterus, scan all the way down, and we're assessing first and foremost for how many babies are in there. And you basically want to make sure to look everywhere and count. So it's not hard, but it's important. So we have one baby in here, and then we're going to do an overview to assess for amniotic fluid. And what we like to do is make sure that the head is filling the cavity and the abdomen is filling the cavity, and that there's fluid interspersed around the arms and legs and face, which there is. So from a Gestalt standpoint, this is normal amniotic fluid. And then finally we want to assess the fetal lie. This is down near the cervix, and so the baby's head is down here. So this is a cephalic or vertex presentation. And as we scan up, mom's left side is over here, so the baby's spine is to the maternal left. And so in order to figure out what's left and right on the baby, we actually want to imagine ourselves crawling inside the uterus, and with our head down here and our back to this side, and that would mean that my right arm would be up. So then this is the up side of the baby, is its right side. And that's important for a couple things. We want to know, when we're looking at the heart, which direction the heart is pointing, making sure the stomach is on the correct side, making sure everything is on the appropriate side. And it just helps us to, if we do see an abnormality in, say, a kidney, we want to know which side it's on. And then we can also take a look at the cervix and measure that. I'm not going to go into that in too much detail right now, but it's always something you want to do to begin with. And then we're going to just start with a generalized, I'm going to cover mainly just the overview of the anatomy. We'll just go from head to foot and talk about whatever comes up. And Michelle, if there are frequent questions that you come across in your classes, then you can let me know.
Well, obviously you could speak for weeks on what is covered in the 20-week anatomy scan and what would be the difference between normal and abnormal, but we really just want to cover the basics as to what is on that checklist of a normal anatomy scan that we would expect to see on a healthy pregnancy, and also, you know, some of the more important landmarks, so we get our measurements done in the same location on all the babies. So
great. So since we're at the head, now we're not getting as good of a picture of it, which obviously is something that happens all the time. But we're going to talk a little bit about the structures that we should see in every scan. And in the head, there's basically three big things. And the first is the cerebellum, which is right here. And we see the two cerebellar hemispheres. We see the vermis, which is in between the two cerebellar hemispheres, and we want to see that that vermis is present and intact. And personally, I don't measure the cisterna magna in every case. I just like to see that it looks about normal in size, and if you do enough of these, you can kind of get a sense of what normal is.
we tell our students that up to 1 centimeter or 10 millimeters is normal for the posterior fossa.
That is true. And then as we scan upwards, we're going to run into one of the other things that we need to see, and that is the cavum septum pellucidum, which is right here. Sorry, it's a little dark. And with the cavum septum pellucidum, you want to make sure that you see the frontal horns of the lateral ventricles on either side of it, and that it truly is a nice little box in between those two, just like right there. And then the lateral ventricle is the last thing we want to see. And we want to line it up so that the choroid, which is that bright structure inside, sorry,
that downside anatomy of the brain is always a little bit easier to see than the anterior superficial side, just due to the proximity of the skull. So you get that anterior artifact of the reverberation. So that the downside is always
exactly
easier
so
to see.
if you notice here, we see this ventricle perfectly. However, up here there's another ventricle sitting right there, and you see nothing. That is all what Michelle referred to as reverberation artifact coming off the skull. So it basically makes everything up there invisible. If you were actually to see that up there, you would get concerned that the bone was abnormal. And we do see that sometimes with some of the more unusual skeletal dysplasias. And I'm not going to do a lot of measuring right now, but I'm just going to show you, to measure the lateral ventricle, we want to measure right across this area, which is called the atrium of the lateral ventricle. And it's right across where the choroid starts to curve in here. And I apologize, this isn't the most perfect picture of a ventricle, but that's basically how you want to measure it. If you do need to look at the upside ventricle, you can kind of swing around and make some sort of tricks and actually come in from the back, and then you can actually see that there is in fact a ventricle up there. But it's not necessary to do that in every case. We assume symmetry unless there's a reason to assume otherwise. So, and as you come down from this view, we're going to immediately get into the face. And really, it's almost in the exact same plane almost always, due to the way the baby's head is positioned in the fetal position. So you're kind of getting this angle through the head that's a little bit oblique. So I should do it over here, like this. So as you come down, you're really almost getting right into the face here like that. And we look at the face in a coronal plane. And our patient here today is actually at 27 weeks. So she's a little farther along than our 20-week scan typically. So things are getting a little more crowded. But you can actually see the nose here with the nostrils and the upper lip. And we're basically looking for a cleft lip in this picture. And we can see that that's not the case here. And then as you scan down even further, again, also almost in this same exact plane, I haven't really twisted the transducer much at all. We can get right into the heart images. And as we do that, there's a few checklists we want to see here. And I'll go over this more in a lecture format, but
That shows the fetal lung tissue nicely in that picture.
Yeah.
You can
So we've zoomed up a little bit on the heart here, and there's a few things we want to notice. First is the axis of the heart. So if you draw a line right from the spine, which is back here, shadowing bone, from the spine, sorry, this is a little bit tight. How about what if I just, I'll just do that.
There we go.
So if we draw a line from the spine right through the sternum, which is in between the front of the two ribs, actually there you can see the sternum. This angle of the interventricular septum should be a 45-degree angle. And we always know, assuming normal heart anatomy, the right ventricle should be the most anterior chamber of the heart. So if we can name that as the right ventricle, then we know this is the left ventricle, and this must be the left atrium, and that's the right atrium. So that makes this the tricuspid valve and this the mitral valve. So just by knowing that one piece of information, we can pretty much identify all the structures of the heart pretty well. And one thing I like to do is just make sure on this picture that I see leaflets moving separately over here and two leaflets moving separately over here. And then I'm pretty comfortable that there's normal valvular and normal ventricular anatomy, and these two ventricles should be about the same size. I don't really look for an atrial septal defect too often, just because the patent foramen ovale always looks like an atrial septal defect. I will look for a ventricular septal defect, however. Also with position, the heart should be kind of centrally located like this. We can talk about this a little more later, but The other thing is that the left atrium should pretty much touch the aorta right there, which it does. So this is a nice picture of the heart here. And you always want to make sure that you're pretty symmetric. So if you look and you're seeing one rib over here, for example, and you're seeing now 3 or 4 ribs over there, you know that you're off axis. So you want to make sure that you try and stay on axis when you are assessing the position of the heart. Now from the heart, if we scan back up towards the head, we're going to come into the great vessels.
That's pretty.
And this is right here, I'll freeze it, is what we call the 3-vessel view. And this vessel will start to get a little bit crowded as we get a little later in pregnancy, which we are right now, 27 weeks. But basically we see a nice longitudinal vessel here and then 2 vessels in cross section. And what this is the ductus arch. So this is the arch of the ductus arteriosus curving back from the pulmonary outflow tract down into the descending aorta. This is the aorta in cross section, and that's the superior vena cava. And you want to make sure that these 2 vessels are about the same size, or if anything, the pulmonary should be a little bigger, and they should march back. This is anterior in the baby, this is posterior in the baby, so they should march back posteriorly. So this is an absolutely gorgeous 3-vessel view, and you can pretty much rule out almost any cardiac anomaly by just showing the nice 4-vessel view, the nice 4-chamber view and the 3-vessel view. But as to point out, as you scan up a little bit higher, you'll actually see that aorta will now cross over and go into the descending aorta. So there's the aortic arch, there's the ductus arch, and a little bit down more inferiorly.
So all your hand did was slide perpendicular to the spine.
I'm not even
plane.
sliding, I'm just angling. That's just about 2 degrees of angulation. You got to remember that the fetal heart is very small. So my hand probably moves 3 millimeters to get that picture to that picture. There's really not much movement. You can see the pulmonary artery branching here as well. So that artery that's branching should be the most anterior artery because it's coming out of the right ventricle, which is the most anterior chamber. So if we come over now in front of the baby and come back and kind of angle back, we can actually look at those outflow tracts a little better here.